The Norwegian Institute of Public Health, or the NIPH, is not recommending a booster dose of coronavirus vaccine before the coming autumn or winter to healthy adults less than 65 years old. They recommended it to adults aged 65 years and above, adults aged 18 to 64 years with underlying risk of a severe disease, adolescents who are 12 to 17 years old with severe underlying conditions, and pregnant women in their second and third trimesters.
Well, the NIPH said for most people, this will be their fourth dose, but for those with, quote, severely impaired immune systems, end quote, this will be their fifth. So the headline there being that really they're recommending it if you're 65 and older. If you're not 65 and older, they're only recommending it if you satisfy a couple different criteria. This is the Norwegian health authorities. I presume are people in American media going to attack the Norwegian scientists for being anti-science and being vax deniers and all of that? Presumably not, right? Presumably we understand that European health officials are, working with much of the same information we have, and that if some of these value judgments go in the other direction, it is not, a damning indication that science has no power in Norway. Norway is not a backward country; it's a peer country in many respects. So I find that very interesting. That I doubt there will be any outrage here. But look, the reality is different countries are. I think Sweden took a slightly different tact with some of the boosters. Different health officials are, making somewhat different calls and saying, well, is this really necessary? We're not sure it is, because part of the reason being you can't demonstrate an underlying benefit. We're having a hard time finding an underlying benefit to getting boosted for people who are not otherwise at risk. That's not to say they're finding a downside either. They're not. It's not in the vast extreme majority of cases. They're not finding it to be harmful. It's just they're also not finding it to make much of a difference. Either way, and thus they can't in good faith recommend something where there isn't an underlying difference. And I think that's what people are missing in this discussion.
Yeah, I mean, it's so funny because, Norway, not known for being a super conservative country, right? It's so interesting how COVID has become like a cipher. You have countries like Canada where, even conservatives in Canada are, super pro-vaccine, big into the booster. And then you have countries like, Scandinavia, like Norway. I believe Denmark was the one that, didn't recommend it for children at all. Places where even liberals are much more cautious about prescribing this stuff, demanding that people take these vaccines and have a much more, scientific, I would call it, understanding of what the science is actually saying. Yeah.
So I did. I got my first booster last week. I got the initial Pfizer vaccine, the 2 shots in April of 2020, and then I got COVID. I got Delta July after that. I never got a booster or another shot or anything. I did decide. Because I have, frankly, been sick a lot this summer, I decided, if I get COVID, I don't want to be. Even if there's a small chance the booster would make me less ill next time I get COVID, I decided that was worth it for me because I'm so sick of sitting in this chair next to my poor guest hosts and coughing all over them. So I got it, and it did knock me down for a day. The next day I was super tired. I was actually worrying I had gotten COVID because I found out I had been in a long meeting with someone who did have it. But the next day I felt totally fine. So that was my just disclosing my own judgment. Maybe it will make no difference at all. I don't think if somebody else with my exact specifications decided they are not going to get it and there's no reason for them to, I totally understand that call. I decided the risk was very minimum, even the benefit also very potentially minimum, but I decided to go for it. So that was the decision I made. But again, I totally understand why. And then even crazier than any of that would be to require people to do it, to mandate it based on so little scientific evidence that it's serving, let alone a personal health benefit, but a public health benefit, because we know it is not really holding back cases to any meaningful degree. So the public health rationale, which would be, we need you to get this because it'll mean there'll be less, cases in your workplace or your school or whatever it is. Like no one on earth is claiming that anymore. So there can't, and many of the mandates have gone away, although there's still, elite educational institutions that have them and some other workspaces that have them. They just are totally indefensible at this point to me, but obviously some people who are very smart people supposedly have made different calculations.
Yeah, I think at the end of the day, allowing people to decide for themselves, allowing parents to decide for their children, the value of autonomy when it comes to your body, your choice. I do think that point of view has won the day, and the people who were pushing that from the beginning have really been vindicated time and again.
Absolutely. Well, thanks for watching, and we'll have more Rising right after this.